let me tell you about Henoch-Schonlein purpura. You can visit my Instagram page by the same name. Well, what is Henoch-Schonlein purpura? From where did the name originated? Named after the German pediatrician Edward Heinrich Henoch and his teacher Johann Lucas Schonlein. Purpura literally means purple. This addresses to the purple coloration of the skin following the small vessel bleeding underneath the skin. With the Henoch-Schonlein purpura introduction. HSP is the most common small vessel vasculitis in children involving postcapillary venules. This is precapillary, this is capillary, and this is a postcapillary venules. These venules are affected. These are called as a postcapillary venules. So these are affected in this HSP. Clinical triads include non-thrombocytopenic palpable purpura. That means there are palpable purpura which on examination have normal thrombocytes, normal platelets. There is no decrease of platelets. Okay, this is a transient arthritis, abdominal symptoms. So the triads are non-thrombocytopenic palpable purpura, transient arthritis, abdominal symptoms. So what about this man? You might have seen this movie. Pa. This is mnemonic here. P for purpura, palpable purpura, for arthritis, transient arthritis, and A for abdominal symptoms. Usually follow an upper respiratory tract infection. Before this disease, there must have been upper respiratory tract infection, and following this, the disease will show up. Okay, going to the pathogenesis. Can you see this IgA immunoglobulin here? Okay, this is Fc portion and antigen binding FAB portion, and this man here, this is a hinge region. Okay, so what is the relation of HSP with this hinge region of IgA? Means there is a defective glycosylation in the hinge region of IgA1. No glycosylation has happened in the IgA. Because of that, this hinge region, which is generally hidden, is now exposed. This will lead to the attacked by preformed antibodies. Antibodies will attack this portion of hinge region. Then in the circulation, antigen and antibody complexes will form. These will settle in many of the places. These places can be small vessels, gut, mesangium, and joints. When these antigen antibody complexes settle in the small vessel, we call it as a palpable purpura. When these in the gut region, leading to the abdominal pain. When these are accumulated in the mesangium, they will lead to the nephritis. When these antigen antibody complexes accumulate in the joints, this will lead to the arthritis. So this is the pathogenesis of HSP. Coming to the clinical features. So to remember all of these clinical features, I have devised a mnemonic for you. NIS gives protection anyhow. NIS means National Immunization Schedule gives protection anyhow. N for nephritis, I for intracranial hemorrhage, S for seizure, G for GI symptoms, P for purpuric rash, A for arthritis, H for hypertension. Coming to the lab investigations, we'll do CBC, ESR is elevated, CRP is elevated, total serum IgA levels can be elevated, yes, and hematuria can be there, proteinuria can be there. Skin biopsy shows leukocytoclastic vasculitis. Renal biopsy shows mesangial proliferation with IgA deposition. Coming to the treatment, mainly there is a supportive treatment, that is maintaining hydration and relieving pain by the medical therapy. In case of the mild HSP, the disease resolves spontaneously, but in the moderate and severe cases we have to give drug therapy, which is prednisolone 1 to 1.5 milligram per kg per day for 2 to 3 weeks. In case of the end stage renal disease, it means there's nothing can be done, only renal transplant can be done. That is all about HSP. Let me quickly revise HSP for you at the end. Okay, quick. HSP means purpura. Purpura means purple. That means 4 mm to 10 mm diameter rashes. Okay, introduction. This is a small vessel vasculitis. Post-capillary venues are involved. Clinical triads: PA. P for palpable purpura, A for arthritis, A for abdominal symptoms. This usually follows upper respiratory tract infections. Okay, done. Pathogenesis: defective glycosylation on the hinge region of the IgA1 exposes hinge region where antibodies are attached. These antibodies will go to the circulation and then settle in different parts of the body. If they settle in the small vessels, it will lead to the palpable purpura. If they settle in the gut, that will lead to the abdominal pain. If they settle in the mesangium, that will lead to the nephritis. If they settle in the joints, they will lead to the arthritis. Oh my. Clinical features. Okay, NIS gives protection anyhow. A laboratory investigation: ESR, CRP and total serum IgA levels are elevated, and will do CBC. Hematuria, proteinuria will be there. Skin biopsy showing leukocytoclastic vasculitis. Okay, renal biopsy showing mesangial proliferation with IgA deposition, and hydration will do. Pain will manage. Mild cases spontaneously. Moderate and severe cases will give prednisolone 1 to 1.5 milligram per kg for 2 to 3 weeks. Last thing, renal transplant. All the best.